If you're someone that recently had a knee surgery and you are struggling to regain the control in your knee again due to weakness, then stay tuned because in today's video, I'm gonna go over what I think is the most important exercise that you must master. Now, I'm a physical therapist who works with patients literally right after surgery, and one of the most important pieces that I believe most people miss is the importance of regaining quadricep strength. This is quad control. These are the muscles on the front of the thigh, and they greatly influence the mechanics of the knee. Most people can get all of their range of motion back, but if they are missing the boat with this specific muscle group, they will realize that it's going to be hard to lift their leg. It's going to be hard for them to put weight on their leg. And even when it comes to more advanced activities like using the stairs, you need to have strong quadriceps. Now, today I'm gonna show you the progression of what I would typically take my patients through when they are learning how to regain control of this quadriceps. Now, just know after surgery, you're gonna have pain. You're gonna have swelling that is going to inhibit that muscle group from working. It's going to feel like it is asleep and it cannot work. And don't worry, that is completely normal. This is why we do corrective rehab exercises that will help kind of restore the strength in the quadriceps, help control so that you can start to do more activities each day. Now, we're gonna start off with the first progression, and that is progression 1 in using the quad set. Now, before you say I've performed the quad exercise or set before, I'm gonna show you some of the common mistakes that I see people make with the quadricep set. Now, a quad set is simply you tightening your thigh and trying to recruit all of the muscles of the front of the leg. This may seem simple, but you'll be surprised how many people actually struggle with this exercise. We are typically recommending this exercise to be performed for 3 sets of anywhere between 10 to 15 repetitions at a time. And what we're focused on here is getting an isometric contraction, okay? That means the leg is not moving at all. It stays straight, but we're really focusing on tightening and trying to recruit all of these muscle groups, all of the muscles of the front of the knee. Now, often I see people and they're emphasizing so much of just straightening the knee. And if you're just thinking about straightening, you might see these muscles kick on, but for some people, it's very difficult. You're not gonna really see any muscle recruitment here. What I typically like to recommend for my patients is that when they perform this quad set exercise that they sit up. So number 1, make sure you're sitting up so that you can visually see the muscle recruitment. And the best way that you can do that is if you compare your non-surgery leg compared to your surgery leg, you're gonna be able to visually see the difference between your legs, okay? So you wanna focus on 3 sets of about 10 to 15 repetitions at a time. Now the important part is the hold. So often when we're recommending this exercise as physical therapists, we might say, hey, go ahead and hold it for 3 to 5 seconds at a time. However, there are some individuals where 3 to 5 seconds is not enough, which means that they may try for 3 to 5 seconds and they're still having a difficult time recruiting this muscle group. Now, what I typically recommend for those patients is to continue to hold for longer periods at a time. That means we are holding for 8 seconds, maybe even 10 seconds. For some patients, even 15 seconds, which sounds a bit crazy, but if we're really trying to wake up those muscles again after surgery, you have to focus on isometric training before you move on to more advanced exercises. So we're focusing on visually seeing what's going on here at the knee, and we want to really see the recruitment of the leg muscles working. Now, moving on to the next exercise, now we can incorporate some movement of the knee. Now, this is important because now we're taking you from a static position where your leg's not moving at all to now more of a dynamic position. So now we're going to take this half foam roller. This is why I love these foam rollers. Some people will use like a towel underneath, which I really don't like because your knee just kind of flattens out. So I want you to use a foam roller if you can. You're gonna wrap that just underneath the knee there. And now we're gonna start to incorporate some small movements of the knee. So remember, we went from no movements of contracting the thigh, 3 sets of about 10 to 15 repetitions at a time. And now once you have gotten good with this, where it has very minimal pain and you can show good control of the quadricep, we are now going to move on to the next exercise. And this is when we put the foam roller underneath. We're still shooting for that 3 sets of about 10 to 12 reps. And now what I'm going to do is I'm going to recruit this muscle group. I'm going to squeeze as tight as I can, and I'm going to lift the heel up off the bed. That's what I'm shooting for with this specific exercise. I don't need you lifting your entire leg. That is a big no-no. Make sure the back of the knee stays in contact with the foam roller, okay? Then you're going to focus on really recruiting this muscle group and trying to get the heel as high as you can. Now, some folks, when they start this exercise, may only be able to lift maybe an inch or even a 2 off. That is okay. That's completely normal. You will get better with this exercise, I promise, if you just practice control. Now, one little tip with this exercise is to get the best bang for your buck is if you straighten out that knee and you hold at the very top, now we can get a nice eccentric contraction, meaning that muscle is working really hard. As the muscle belly is lengthening, I'm also strengthening that muscle at the same time. It's going to allow you to build strength the faster way so that you can start to move on to more advanced exercises. So we're going to call this short arc quad or a shorter leg extension, and this is preparing us for our last exercise progression. So if you made it this far, you're finding this video beneficial for you, please don't forget to subscribe below and show me in the comment box more questions or ideas that you would like for me to make videos about. Now, we're going to give you the last exercise, and this is probably the most hardest for people because now we're taking that knee through greater range of motion. This is called the longer arc quad or the long arc quad. Basically, this is a leg extension. I know many of you have been to the gym. You've seen the machine where both legs are moving up just like that. This is basically simulating that same exact exercise. Such a great exercise. But after knee surgery, this is very tough because now you're forcing the bottom of your leg, the lower leg, to work against gravity. So when you're starting off, it may feel like just using no weight is going to be very difficult, but I promise you it will get easier. Now, what we're going to do in this position, you are sitting up nice and tall, not slouched like this, not leaning backwards like this, but you are sitting nice and tall. Now we're going to focus on pointing those toes up. When we point those toes up, it allows me to get some good initiation of that quadricep. You're doing your best to straighten that leg as high as you can, and then you come back down. Now, once again, we're showing nice, good control on the way down. We're not just plopping it down. That is a big no-no. Make sure you hold it at the top and you show nice, good control. You might even feel some shaking there. That is a good sign. Do not make the mistake of only training your surgery leg. We cannot forget about the non-surgery leg and how much the other leg is still helping us out with moving out of bed, getting up from the chair, going up and down stairs. So we must train both sides here. 3 sets, 10 to 15 reps at a time with control. Now, if you find at home that this is just too easy and you want to maybe step it up a notch, with many of my patients who have been very fit and active previously, they're telling me this is just too much of an easy exercise for me. Can I do something more? Well, this is why something like an ankle weight can be very beneficial, because now we can wrap it around our ankle and we're adding some load, and all I have here is about 5 to, I think it's almost like 7 pounds. But this is perfect because now we can isolate one leg at a time. Now the weight is pulling my leg down, and now I'm going to use my quadricep muscle to lift as high as I can to get a nice good contraction and to strengthen those quadricep muscles. Then I'm going to lower back down nice and slow, showing good control. Now, just like with the previous exercise, back of the knee has to stay in contact with the chair or the bed, wherever you're on. I find that something firm is a lot easier to perform this on, because if you're performing this on a bed, it's definitely your leg's going to push into the bed, and it's going to be hard to get some good leverage against the back of the surface there. But keep the back of the knee in contact with the chair there. You're going to lift the leg as high as you can. Try your best to extend your leg out in front of you, and then lower back down. You might find that only partial range of motion is tolerable for your pain, or partial range of motion is what you can tolerate. That is okay. You will get better as you show more improvement. Now, if you want to learn more ways on how to continue to improve your range of motion, continue to improve your strength, make sure you check out my surgery playlist on my channel where you can find more videos about how to strengthen your knees after this type of procedure. Thank you for watching, and I will see you in the next one.